And I joke it worked until I actually had to use it. My little one, who was 1 at the time, was having recurring ear infections. And so we went to the ear, nose, and throat doctor, who said she's got a hole in her ear, a perforated eardrum. So we had to get tubes in her ears, went to the local hospital, 15-minute procedure. And I got the bill about 3 weeks later, and it was $8,000. So I had to stroke an $8,000 check to the local hospital. It was at that point that I said, this insurance thing is a scam. It's fraudulent to say that they will pay your bills when nearly 1 out of 5 times they don't actually pay your bills. If something big happens to you, I'm here for you. If something big happens to me, you're there for me. I kind of joke, that's the only person on the planet who rejoices over kidney stones, because if they wouldn't have had those kidney stones, that guy probably would be dead.
Today we've got Andy Schoonover, who's going to talk to us about, we're not going to call it health insurance, we'll call it a way to get your health bills paid. Is more and more accurate, because we talked on the phone about this. And if you don't mind, just maybe introducing who you are, and then we'll get into this.
Yeah, as you mentioned, I'm founder and CEO of a company called Crowd Health. And the origin story here, I think it will resonate with folks. This is my second healthcare company. I sold my first one a few years ago, and came off of that, and I had a decision. I could either do Cobra, which, as you probably know, is ridiculously expensive. I think it was $2,800 a month or something like that for my family. Or I could go to Obamacare, which was $1,400 for my family. And so I bit the bullet and did that. And I joke it worked until I actually had to use it. My little one, who was 1 at the time, was having recurring ear infections. And so we went to the ear, nose, and throat doctor, who said she's got a hole in her ear, a perforated eardrum. So we had to get tubes in her ears, went to the local hospital, which is the only place in town that was in network to get tubes in her ears, 15-minute procedure. And I got the bill about 3 weeks later, and it was $8,000. And I'm just like, holy crap, $8,000 for a 15-minute procedure. And then little did I know, my Obamacare plan 3 weeks later was going to notify me that it was medically unnecessary. And so they weren't going to pay the bill. So I had to stroke an $8,000 check to the local hospital. It was at that point that I said, this insurance thing is a scam. There's no way that I'm going to continue to pay these bills just to have the insurance company deny mine. And after I did some research, there's 200,000 families every year, somewhere between 200,000 and 250,000 families every year go bankrupt, even though they have health insurance due to medical events. And so I went uninsured, and I have been uninsured since. It's been about 4 years. And ultimately, I was like, you know what? I think there are other people out there that feel the same way. So let's start a company. I never thought I was going to get back into healthcare after the last round. It's a brutal thing to operate within. But started another company called Crowd Health, in essence, to help people who are uninsured or who would like to be uninsured, who'd like to escape the tyranny of health insurance, pay for their health bills.
Yeah, interesting. I didn't share this with you, but when I got out of practicing as a surgeon, I didn't have health insurance for a while. I didn't have health insurance for, 4 or 5 years. I just didn't want to pay it. I was a healthy guy. I'm like, and honestly, it was expensive for me. And it's like $700-800 a month or some ridiculous amount, which is for many people it's a real strain on them. And particularly when you put a whole family in, then you're talking quite a bit more of that in many cases. And what am I paying for? I'm not really using it. I'm not getting much out of it. And I do have health insurance right now through our company, but again, at the same time, is that necessarily the best thing? And when you say it's a racket, I guess before we go into what you do, what do you mean by that? How is your health insurance? Some people will consider them somewhat predatory. Their practices are maybe not in our best interest, and more obviously any company's in their best interest. But how does the insurance company work that's a problem in your mind?
Yeah, I think that we have this idea that if we have health insurance and we have a health event, that the health insurance companies will actually pay for it. But in fact, we've got, in the Obamacare plans alone, the last data that they showed was about 48 million claims were denied. I think this was 2021 data. I don't know what 2022 looks like, but 48 million claims were denied, in-network claims were denied by these Obamacare plans. And that's about 18% of total claims. So you got about a 1 in 5, 1 in 6 chance of your claim being denied. And that's leading people into bankruptcy. And so I think it's fraudulent to say that they will pay your bills when nearly 1 out of 5 times they don't actually pay your bills.
These claims denials, is it like, hey, they wouldn't pay for my breast enhancement? Or what, is it legit like these are real Because there's some reasons like they said, your kid medically unnecessary, which I'm confused as to why they determine that. If the kid's got a valid condition, this was considered the treatment. There's obviously, and I've dealt with insurance companies, and I know sometimes, man, when you're trying to get some procedure done for some patient, they fight you tooth and nail, man. They're like, and that's why a lot of physicians, because you got to spend on the phone for an hour to try to advocate for your patients. You just don't have time to do it, unfortunately.
Yeah, totally.
But what are the nature of these claims denials? I'm obviously 41 million of them, or 200 million.
A big chunk of them are medical necessity, and all of them are in network. Like all the entire group that I just mentioned, those are in network claims. So that doesn't even include the out of network claim. These are all clearly not all, but the majority of them are legitimate bills that people are trying to get paid. And in fact, many of these health insurance companies, I saw one this morning, United Healthcare, has some AI algorithm in which they just blanket deny claims across the board. And Cigna has another lawsuit on this. And a lot of times they just blanket deny. And an interesting thing for mine specifically was tubes in her ears, perforated eardrum, needed tubes. My ear, nose, and throat doctor was talking to what I believe was an ophthalmologist at the health plan, trying to convince an ophthalmologist of something that needed to happen in their ears. So an ophthalmologist, as clearly, but if your folks don't know, those are doctors for the eyes. So they have nothing to do with that. And I think there's just a perverse incentive here for health insurance plans to, deny claims. The other perverse incentive that we have is that health insurance plans actually want claims to go up. And let me explain the reason why. So if there's a rule now in healthcare, it was passed under the Affordable Care Act, where health insurance plans can only profit 15 or 20, depending upon what type of plan it is, % of premiums. So if you have a premium of $1,000, the max you can profit or use for administrative costs is $150. So how do you grow that 10%? Or how do you grow that from 150 to 165? The premiums have to go up. And so they actually have an incentive for premiums to go up because that means they can make more money. So you have your agent, it's a principal agent problem. You have your agent who's supposed to be working on your behalf, who actually has incentives to see your costs go up and your your claims being denied. And so that's why I say that health insurance is a scam in many ways.
When you say they want the claims to go up, they want more people requesting things. How does that cost them more money if they're denying them? Do they have there's some sort of, this is the rate of denials that we're allowed as well? Is that set by law, or is there, I'm not sure.
Yeah. So over the long term, right, over years, you want to see those claims numbers, the cost of healthcare to actually go up because you can make more money. In year, right, they are managing around this 15%. So let's just say that they're seeing claims so that the maximum profit they can get is going down to 12%, then they can actually deny claims in year to navigate around that 15%. And so that's why, and that was allegedly what some of these plans were doing in some of these lawsuits, to say, okay, I'm getting below my threshold for what I can profit. And so I'm going to start denying claims to get back up to that threshold, knowing that, and this is again 21 stats, only 1% of the claims that are denied are actually appealed. And so they know that when they deny the claims, the appeal process is going to be very low. So they just go and do that. So those are the perverse incentives that I think, look, these health plans are not on our side. They're not fighting for us. They're fighting against us. And how many times have you heard your patients or friends or family or whatever, now I got to go fight the insurance company to get my bills paid. What we're trying to do is the exact opposite of that, which is we want to fight with you to get your bills paid as opposed to fighting against you to get your bills paid.
One other thing that I just heard about, it, I think it's been going on for several years now, is some of these healthcare companies are being bought out and owned by, like I think CVS owns one of the major health companies, maybe Aetna or something like that. I can't remember which one it is, but CVS is a prescription drug dispensing company. It's a pharmacy, right? So how is that even legal in my mind? I just see the conflict of interest there as being just enormous, but why is that allowed?
Yeah. It shouldn't be. I think, and there's lots of conversations going on in Congress right now whether that should be allowed. I think the other one is United Healthcare is the largest owner of doctors, the largest employer of doctors in the country. So the company that's supposed to be negotiating with the doctors to get great rates for you, the patient, now owns the doctor. And so they're negotiating against themselves. There are 1 million doctors in the United States. 100,000 of them are employed by United Healthcare. So 10%. That to me is a problem. So you have a doctor that you're going to that you think is going to act on your behalf, but it is actually employed by the insurance company, so is acting on the insurance company's behalf. And I always say that you work for whoever pays you. If the doctor is getting paid by the insurance company, they are working for the insurance company. They are not working for you, the patient, because you are not paying them. And I think that's a really huge problem in terms of guiding us in terms of the best path for how we can get healthier. It's a huge challenge.
Yeah, I can tell you, like I said, as a physician, there's like what you would want to do and what you can get paid for. This is what you need. There's no one's going to pay for it, so we can't do it because you've got to pay for the operating room or whatever the costs are. So let's talk about the genesis of Crowd Health now. So you got frustrated with this. Your daughter gets denied. You're paying whatever premiums, and then they say, well, you got to pay $8,000 anyway. We're not going to even cover this. So how did you go about founding Crowd Health, and what is Crowd Health?
Yeah. And as I walked through that, I thought to myself, like, why am I paying, I think it was $1,400 or something like that a month for my family? So that's say $16,000-ish, $17,000 a year. Plus they're making me pay for all these other things. I'm like, man, I'm $25,000 or $30,000 in before the health insurance plan has to pay anything. And what is the probability of something big happens and my family is going to have to take care of it that's above $30,000? And the answer to that is very small. However, there is a probability. Albeit small, there's a probability. And so what would happen if a bunch of people like me got into a community and said, hey, if something big happens to you, I'm here for you. If something big happens to me, you're there for me. And so in essence, what we've done at Crowd Health is we built this community of now we've had almost 6,000 people who've used us, who are all actually funding each other's healthcare expenses. So imagine that, I'm going to use a little bit of an analogy. You have a Venmo account. Everybody knows what a Venmo account is. Now imagine if you broke your arm and it's $5,000, and then you had 50 people send you $100 into your Venmo account. So now I have $5,000 sitting in my Venmo account that I can go directly to the doctor and pay for my broken arm. That's in essence what we're doing at Crowd Health. Now it's not a Venmo account. We have a Crowd Health kind of health wallet that we use. But if I were to go to get my broken arm, I'd go in essence, crowdfund it from a group of people. Crowd Health does that for you. And now I have money. I can pay the doctor directly. And as a result of paying the doctor directly, we're getting about 50% better prices than United Healthcare for healthcare services. So we're paying somewhere between 140 and 150% of Medicare for these healthcare services, or we're giving those prices to our members. United Healthcare is paying somewhere between 250 and 300% of Medicare. For a broken arm or a cancer case or a hysterectomy or a whatever, we're getting for our members about 50% better pricing than some of the largest companies on the planet.
It's disturbing that even exists, because if I go to the grocery store and I'm going to go buy, let's say I go buy, I don't know, some oranges. I don't buy oranges, but let's say I go in there and buy some oranges, and I walk in there and it's, I don't know, $2 an orange or something like that. But then somebody else walks in there and get it for 12 cents an orange. And they've got this discrepancy in prices. Why is there not one price for everybody? Why so much of this? One guy has to pay $10,000 for a procedure and the other guy gets it for $500. Why is that even allowed? What's the story behind that?
Yeah, I think you mentioned it earlier in one of your descriptions. As a surgeon, you often had to spend an hour on the phone with a health insurance plan advocating for your patient. Now, what if you had that hour back to actually be doing surgery, right? You probably also had a bunch of billing people on the back end who were billing health insurance companies. What if you didn't have any of those billing people? What if somebody showed up and said, hey, I'm going to pay you with my credit card. So instead of 20 or 30% of your fee getting sucked down by bureaucracy and billing, you have 1.5% sucked down from just credit card fees. And so what in essence the doctors are seeing is, look, I can spend more time with my patient. the relationship now is between me and my patient. I don't need to get approval from health insurance companies. It's way easier to get your money, and I get money right away. So I don't have to wait for 2 or 3 months to get that money. And so doctors are like, look, I will give you significant discounts if you can pay me at the point of care. And so in essence, it's just the healthcare plans are really hard to bill. They're really hard to get money from. And so if we make it really easy on the doctors are like, yeah, we'll give you great rates. And so that's the number one driver. The second driver is that we keep people from having unnecessary operations in the hospital. So if it's an outpatient procedure, there's no reason to be doing this in a hospital. The vast majority of the time, you can do these at surgery centers. They're nicer. They're way less expensive. And so we can get you into a surgery center and save a bunch of money as well. So there's a couple of things going on here, but those are the two primary drivers.
But I think most people try not to go into the hospital for when possible. I know when I was operating, I'd much prefer to be operated at a surgery center than a hospital, is because the efficiency is way better. And like you said, it's a nicer environment in many cases. But so here, and this is the thing, because when somebody hears about this, that's great. And we talked about this on the phone, but because you guys are crowdfunded, what is to prevent somebody says, oh, it sounds like great, I'll sign up, I'll pay my fee, and then I'll just go get massages every week, or I'll just abuse, because there's people that will like, oh, I'll go get therapy once a week because somebody's paying for it. There is a deal where people, because they're not directly paying for it, like I pay my premiums every month and I never use the damn stuff. It's there in case I'm in a car wreck, basically, but I'm paying for someone else to whatever. And some people legitimately need it, but some people probably do things where maybe they abuse the system. How do you get that out of the system? How do you fix that part?
Yeah, we've got very clear guidelines that say, here are the things that are eligible for funding and here are the things that are not eligible for funding. And so your massages and those types of things, like those aren't eligible for funding. And so we make that very clear up front. You sign something that says, I understand what's included and what's not included. So that's what keeps people from doing that. I think the other question that people have is, hey, if this is truly like crowdfunding, then like, why don't people just mooch off of everybody else, like free riders? I can get asked for $100, but I don't have to give $100. And we actually don't kick people out if they don't give $100. But what we do is we actually allow people who are getting asked to see what the member who is asking is like. And there's two ways of knowing that. One is, for example, if I'm asking Shawn for money, you'll know that over the last 10 times that I've been asked, I've said, yes, 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 yes to people, or I've said no, 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 no to people. And if I've said yes, 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 I'm a good member of the community. And so the probability that you'll give to me is much, much higher than if I were to say no, 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 no. And so there's a bit of a reputation score or reciprocity that is created there. And then the other thing is people are like, oh, how do we not just go and get crazy surgeries for crazy amount of money? And so the other thing that we do is on the bill, we will actually say, hey, this is an egregious price that this person paid, or this is a reasonable price that this person paid for this specific procedure. And the way that we validate that is if we can get a procedure, we only score things above $1,000. But if we can get a procedure that's 20%, more than 20% better than what you got, then we know you overpaid for that procedure. So it's just to keep people from going to the Mayo Clinic for a flu, that type of stuff. And so we've done, I think we're on bill 10,000 and something now. And every bill that's gotten submitted to the community has gotten funded. And so that's everything from a little pediatric $49 virtual visit to colon cancer and brain hemorrhages and motorcycle accidents. And we have a brain surgery going on next week in Arizona. So all kinds of huge bills that have been successfully funded this way.
Wouldn't go into insurance plan. It's like there's a prescription for drugs. There's routine outpatient doctor visits. There's surgeries, hospitalizations, catastrophic care that would be part of most people's insurance plan. Are you guys full service like that? Or are there things you completely exclude? Do you cover drugs? What's the story on that?
Yeah, so the way that we look at it is in terms of health events. So if you have a health event, so let's just say cancer, that could be 50 or 100 doctor visits or meds or hospital visits or whatever. That's all one health event. And so we ask you to pay for the first $500 of that health event, and then we'll submit everything else to the community. So it doesn't matter if it happens all in 1 year or 2 years or 4 years. It's all one health event. We only ask you to pay the first 500, and then we'll submit the rest. And the idea there is anybody can come up with $500. Not everybody can come up with $10,000. And so the fact that we have 200,000 people going bankrupt every year due to medical expenses, we wanted to eliminate that, erase that. So that's the kind of the key component there. And then, so yeah, everything that do with a health event, medications, physical therapy, all that kind of stuff is included, and you can do those types of things. The only thing that are excluded is we don't do Medicare eligible folks. So if you're 65 or over, we don't do those folks, and it's a regulatory issue. If you're a smoker, we don't do that. And if you're over 240 without an exemption, we don't do that. So somebody like you, clearly would get an exemption. Clearly would get an exemption, because people who are fit and over 240 or tall and over 240, like that makes sense. But you shouldn't be 5'8" and 240. That's just not a healthy weight to be at. And in fact, we've had a lot of people come back now and say, hey, I have made lifestyle changes to get under that weight and to be a part of Crowd Health. And so it's actually incentivizing people to, and I think it was a follower of yours actually, who went into a strict carnivore diet and got under that weight limit and has continued to lose weight. And he just texted or Twittered me the other day and said he came in third in a triathlon that he just did. We think that this actually incentivizes better behavior too, in terms of taking care of your body.
Yeah, one thing when we talked on the phone a couple of weeks ago, one of the things we discussed was the fact that in general, the people that are in Crowd Health tend to be a healthier user base. You're excluding the Medicare population, 65 and older, so that's automatically people younger, they're going to be healthier in general. But are you like, what if you roll in there and say, hey, I'm a type 1 diabetic and I have insulin every month, or I've got Crohn's disease and I'm on these infusions. Are they eligible for your services, or how would you deal with those folks?
Yeah, they're eligible. They're just responsible for their own healthcare costs for the first 2 years. And so it's okay. You have to be in the community. You can't just come and drop a health bomb on the community and then bail out. Like, you can't have a knee replacement and then bail out. Come in, get your knee replaced, bail out. That's just not something that we're willing to do. With that said, we have a bunch of type 1 diabetics. We have a bunch of type 1 diabetics. You're like, I can get my insulin cheaper, my supplies cheaper with Crowd Health than I can anywhere else, because we give them access to really low cost meds. And so the math makes it so that I'm saving significant amount of money with Crowd Health as opposed to regular health insurance. And we welcome them in. We're happy to have y'all in our community.
How do you get the cheaper meds? I'm just curious. And why is everybody else paying jacked up prices?
Yeah, because these health insurance plans go through what they call a pharmacy benefit manager, a PBM. The PBMs take a significant chunk of what you're paying or what the health insurance plan is paying for those medications. And so if you can rip the PBM out from in between, you're saving a significant amount of money. We're paying about 90% less for generic drugs, or our members are paying 90% less through our partners than health insurance plans are paying. And most of us, what we need is a generic drug, if drugs at all. Which is the other thing too that I wanted to point out real quick, is we are all about holistic, integrative, naturopathic health. Alternative forms of health are something that we're absolutely fans of. And so we want people to think about other alternative ways of getting healthy as opposed to just going directly to the pharmaceuticals. I think that a lot of the things that you're doing and promoting are along those lines. I think a big chunk of our people are either straight carnivore or keto, just given some of our marketing efforts. And so you are getting into a tribe of people, if you join Crowd Health, that look very much like you, have similar values in terms of what we put in our bodies, our animal protein, heavy, seed oil light type of people. And so if you're looking for a community of people to fund healthcare expenses, that's a great group of people to have. Average age is 34. BMI is 4 or 5 points below the national average. And they are very much our tribe.
All 50 states, correct?
All 50 states, DC, Puerto Rico, and Virgin Islands. Yeah, we have members in all 50. Doesn't matter where you live. We don't have any doctor networks. And so given we don't have any doctor networks, it doesn't really matter, which I think is important. You can go to whatever doctor you want. We're not telling you what doctor you can or cannot go to, which all we ask is for the big ones, you call us. Let us help you find a great doc at a reasonable price.
Yeah. If I just go to Joe Smo doctor down the street, and do you guys get involved to discuss the fee, or how does that work? If I walk and say, hey, I'm cash paying, I got Crowd Health, how do I pay it? Who decides the cost there?
You just go in and say, hey, I'm a self-pay patient. Do you have a self-pay discount? And most of them do. So they'll give you a discount right away. You pay it, you upload it into our app. It takes about 15 seconds, literally, to upload into the app. And then we take it on the back end. We'll crowdfund it for you. We'll get that money back to you, the money that's been crowdfunded for you. And so you pay it up front. It gets crowdfunded on the back, generally for those small bills. For the big bills, they're typically planned. So they're like, hey, I got a knee replacement next week. We'll crowdfund that beforehand so that you have money to pay for it when you show up. So you don't have to front $15,000 or $20,000.
If I just, let's say I have a urgent care, I go in and I cut my arm and I need stitches, and I walk in there and I say, hey, I'm self-pay. They're going to want money pretty much when you hit the door, usually, I think. So how fast are you able to get money for something like that? Is it like, okay, here's the $2,000 you need or whatever it is?
Yeah, usually with urgent care, let's use your stitches, for example. I had a guy, a member who's a friend of mine, actually an investor of ours, who reached out to me and is, hey, my daughter, I think she had 6 or 7 stitches and they went to urgent care. He said, I went to urgent care instead of the ER because I know from education by you all that I should be going to urgent care for some of these things as opposed to the ER. There's no reason to go to the ER for stitches unless you're just gushing blood. And he paid like $225 for 6 or 7 stitches. If you're going to the urgent care, like you're not paying thousands of dollars. You might pay up to $800 or $900 probably, but you're not paying thousands of dollars to go to urgent care. If you go to the ER, what they will do is they will bill you after the fact. So you show up to the ER, something bad happened, they will send you a bill 3 or 4 weeks later. And at that point, then you upload them to our app. We have a team of attorneys who will actually negotiate these on your behalf. And so we get all those bills. We call the hospital. We say, hey, I'm calling on behalf of Andy, who has a $20,000 hospital bill. This is not fair. These prices aren't fair. You overcharged, you double charged. We do all that work for you on the back end. Would you take $5,000? And they will say, yeah, we'll take $5,000. At that point, we'll crowdfund the $5,000. You'll have $5,000 in your account, which then you can pay the hospital directly. And that's how we do emergency visits. So it's all pretty easy stuff. And the great part about this is you have your own personal care advocate, that you have her number. You can call, you can text, you can email anytime you want if you have any questions, and they can get back to you really quick. So if you're like, hey, how do I do this? Just text and she'll text you back with a response pretty quickly. So we don't have call centers or any of that crap that I hate with health insurance companies.
Do you know what the average health insurance premium is for persons in the country? Like the average, like single person, what is that?
$7,000 a year
annually. So
that's and $22,000 for a family.
So it's $600 a month, or just under $600 a month as average.
Yeah.
And so I remember you talking about, I think you said something like 50 plus 125, so 175 a month. Is that, could you say we're going to crowdfund something? There people are paying in, I don't know if you want to call it a premium or whatever, a membership fee, and 50 is your administrative fee, and 125 is going into the general crowdfund pool. But if somebody all of a sudden some guy goes in there, oh my God, one of our members just had this catastrophic, brain tumor, and we got to deal with that. Do you have to raise additional funds in addition to that, or how does that work? How's that the actual crowdfunding work?
Yeah, it's a good question. It's way different than your typical health insurance. So what we do is we actually charge you twice a month. Once is $50. It's a subscription fee, a membership fee that comes directly to us. The second is up to $125 if you are single, or up to $375 if you have 4 people in your family or more. And so what we'll do is we'll say, Andy broke his arm, $5,000. We will ask you for 100 of it, or 125 or whatever. I'm going to use 100 because it's easy math. So we'll ask 50 people for 100. And this may be any time during the month, but we say, hey, we're only going to ask you up to 125. We will never ask you more than that. And so we're going to ask you for 100 to send to Andy. That money goes directly from you to Andy so that Andy has the money. Crowd Health does not get in between that. That's a peer-to-peer transaction, but you know that your money is going to Andy. It's not going into a big pot that United Healthcare gets to decide where it goes. It's going to Andy for a specific health event. And I think that's important because I'll give you just a quick example. 6 or 9 months ago, we had a member with a miscarriage, and there was healthcare expenses associated with that. And so we went to a bunch of people and we said, hey, would you help this person with a miscarriage? And we had a number of people come back and say, hey, listen, I know that you asked for $100, but a miscarriage, that's a part of my story too. I know what this member's going through. I've been there. I know the pain that they're experiencing right now. And so can I give them $200? And it was like, what? You want to give them more? Like, you would never in a million years call United and say, hey, can I give you more this month? Like, it just never occurs. And I think there's like the insurance companies have put themselves in between us and has sucked the humanity out of this. Because for ages, if somebody got hurt in our community, we would all gather around them and we would go and plow their field, or we would take care of their kids, or we would do what we need to do to have that community member taken care of. And now, from my perspective, the government insurance companies have gotten in between that and say, hey, you don't worry about it. I got it. And so we're trying to bring back that community component of that, where the money goes from member to member. You're helping each other directly. And it's just a beautiful thing to watch. And I have that one story. I've got a dozen other stories that are similar to that, where we're trying to bring humanity back to healthcare.
So $50 a month guaranteed, and then up to 125. If I'm a single guy, up to $125. Maybe some months I'll pay 75, maybe I'll pay 110 or something like that. But never more of that unless I voluntarily decide, hey, I want to give extra for whatever reason. Maybe I'm feeling particularly altruistic. But do you because you're saying, hey, I need money for a person's whatever. They're going to have a baby or something like that. I don't want to pay for that. How do you get around, because some people, they don't want to share their health information. Maybe they don't want other people to know that. And so is it anonymized, or do we have a member that needs XYZ procedure? Or is it like, hey, this is Sally, here's her picture, here's where she lives, here's her Facebook page. How do you protect I guess there's some HIPAA stuff that you have to think about.
Yeah, we just say this person, male in Austin, Texas, or female in Nashville, Tennessee, has this specific condition. Will you help him or her? And so we don't get into it's Andy, it's Shawn, those types of things at this point. I think for privacy reasons, that's probably not something that's going to ever happen unless people want their name known. Maybe there's an option to do that at some point in the future. But I think for privacy and HIPAA reasons, we will keep that all anonymous.
And you said something about like a rating system, like an Uber driver. The Uber driver's got a 4.8 rating and the passenger has a whatever, and they decide to want to. When you say, because we've got 5,000 members, 6,000 members, you say, hey, we got somebody that needs $8,000 for something. Mm-hmm. Do you distribute to the entire network so everybody pays in $3 or whatever it is, or is it say, or maybe only 50 people, or maybe 200 people step up and each put in $100? And is it selective? Like I say, hey, I don't feel like funding that. And how do you make it equitable, I suppose? So one guy isn't always funding and some guys are just putting in $2.
Yeah. We will ask everybody during the month for something, but we're only going to ask you once. I think it's annoying if we've got 1,000 bills this month. If I sent you 1,000 emails, you'd be pretty pissed off at me. So I only ask you once, and it's round robin. So we start with the person who gave the farthest back, and then we move forward. So that's how we always do it. So never will a person get billed twice before another person is billed once, because it's a round robin style situation. And then whenever somebody else joins the organization, they kind of get stuck at that point, and then that's where they are in line. So it just keeps going round. And we will ask everybody for something in the month, because if you go to the end of the month and we still have 1,000 people that haven't given, we have a bunch of like pregnancies and things like that we know are going to happen that we can pre-fund. And so we will ask everybody for something during that month. And over the last 3 or 4 months, it's ranged between $65 and $100 for an individual. So that would be $195 and $300 for a family. And the reason why it goes up and down is because if you have a big health event, then we pop it up because we need people to give a little bit more. And then when we don't have that health event, it comes back down a little bit. So it bounces along the way, but we keep enough at the top so that if there's anything really big that happens, then we can ask them. So we've never asked anybody for over $100 or for an individual. So 100 of that 125, we've never asked for any more than that. And we're keeping that so that if there is a massive event that we have to fund, we have some ability to do that. We were actually up to 100. We had been around 75 for a long time. We were up to 100 this month because we had a really bad, we have a brain surgery. We have a really bad spine injury, and we have two NICU babies. So we had them all fall in 1 month. And so you do that. So you just pop it up a little bit, and we're like, hey, then we go out to our people, and we're like, this is why it's a little bit, we're asking you for a little bit more this month. NICU baby, brain surgery, all these things. And they're like, oh, okay, that makes sense. I get it. And then it'll come back down again once we get those things paid for. So that's the way that we've operated. We think that holding a big pool of capital on the back end is massively inefficient. Capital inefficient, especially with the inflation rates going on right now, it doesn't make any sense. And we've been able to pay bills, get our members' bills paid very efficiently, effectively.
So there's a question from Charlie's asking, let's say you roll in, you say, doctor says I need an appendectomy, and they find something untoward, and they find cancer, or they have complications. Let's say you end up with simple appendectomy turns into sepsis and blah, blah, blah. And the bill goes from $5,000 to $30,000. How do you deal with that? Same thing, just crowdfund some more, or how's that work?
Yeah, I think the closest analogy that we had was a member had kidney stones, went to the ER with kidney stones. As they were doing the scans, they're like, hey, you got something in your colon. You need to go check this out. They went and got a colonoscopy, found out it was colon cancer. Praise God, man, like stage 2, got rid of it. Look, he's looking good. But I was like, I joke, that's the only person on the planet who rejoices over kidney stones. Because if they wouldn't have had those kidney stones, that guy probably would be dead. You don't catch colon cancer, and it kills you most of the time, as you probably know, right? Yeah, all of that was one event. And so that colonoscopy ER visit and the colon cancer surgery, I think it was something like $40,000 or $50,000, $60,000, something in that. And yeah, we'd do the same thing. We'd ask 500 people for $100. That's, if my math is right, that's $50,000. And so that was a little bit of a pop in that month. I think we raised everybody about $5 that month or something like that to get it paid for. And it worked out great. That guy's our biggest advocate. He's like, this is the greatest experience ever. Because if he was on an Obamacare plan, he would have had to pay $10,000 or $14,000 in deductible. And so it may have been even more than that because it overlapped a year. So your deductible just starts over again. So he's our biggest fan. He lives up in Dallas. He's a good dude.
What if, I think you told me that a certain percentage do, like some people have insurance, but they don't want to get screwed like your daughter did. They don't want to, so this could be like an add-on to the people that are already insured. And how would you deal with that? Would you say, hey, the insurance is going to pay for this anyway, we're not touching it, and then we're going to cover the overages? Or how does that work if you already have insurance?
Yeah, it's a great question. We have about 20% of our people who also have health insurance. And the way that works is we say, look, you got to submit it to your health insurance first. And then whatever doesn't get paid for by your health insurance, we're happy to crowdfund for you. In that case, most of the time it's a deductible. It's like you have a big event, you have a $10,000 deductible. You can submit up to $10,000 to the community for funding, and we're happy to do that for you. So that's the way that it works. It's pretty straightforward.
Would those, because you have a selection criteria, what about the people that are sicker, older, if they have health insurance? Would there be any possibility they could join Crowd Health? Yeah, I think we've got a decent chunk of people who are in their 50s and early 60s. And in fact, we get a lot of people who hit that 65-year age and they're eligible for Medicare. And they're like, please, I don't want to go on Medicare. Please, can I stick around? And those are treated the same way. If they've got pre-existing conditions, then it's treated the same way as everybody else. You got to pay for it the first 2 years. And after that, the community can help you out. But there's no change for those folks. We don't treat them any differently. You had mentioned, I remember we talked about this because I'm like, insurance companies, I guess by law, they have to include, I guess, the Obamacare. One thing that people thought was good about Obamacare is they denied the pre-existing condition denial type of thing. So everybody, doesn't matter if you're the sickest person in the world, you get health insurance, and you guys don't necessarily do that. So some people say, is that illegal? Is it? And I think you said in Washington State, you had to define how you were. Maybe you can talk about how this is actually legal, because some people would say that the insurance companies can't do this. This is illegal for them to do it, but you can. So how does that work?
Yeah, so we've had 2 states who have reached out to us and inquired in our business model. We are only direct to consumer. We don't do any corporate stuff, and personal insurance or individual insurance is regulated by the states. And so the states are the ones that are coming to us and saying, "Hey, listen, I think you're health insurance." And both times the states have said, "Okay, we thought you were, but you're not actually." After a pretty extensive investigation, one was 9 months, and it cost us a couple $100,000 of attorney's fees to get through. And the reason why is there's a number of reasons. One is we don't pool resources. So there's no big pool of funds on the back end. So we're not pooling risk. So that's important. Second is CrowdHealth does not touch the money. So we are not a conduit of that capital. It is a person-to-person true crowdfunding, not too dissimilar from GoFundMe. And so if you want to shut us down, you have to shut GoFundMe down. The other component, and there's probably a dozen components, but these are the biggies, but it's your bill goes up and down every month depending upon my request from you. One of the, actually the Supreme Court ruling said that as insurance is a defined payment for a defined benefit. The payment for us is not defined. It changes from every month, and there is no defined benefit. And so this is getting into very legal kind of jargon, but for a number of legal reasons, we just aren't health insurance. And in essence, when you join CrowdHealth, you are responsible for your bill. We are not responsible for your bill. And some people are very uncomfortable with that, but we will fight for you to get that bill paid and go to our community and do whatever we can to get that bill paid. But you are ultimately responsible for that bill. And that sovereignty over your own bill, I think, is a very healthy thing for the healthcare system in general, because what happens if you're not responsible for that bill? You try to extract as much value out of the system as possible. You don't care what the prices are. And that's what has led us to the healthcare, system that we have now that's incredibly expensive. Just think of the situation in which you go to the hospital in which you have health insurance. You don't care what they give you. Now go take the situation in which you go to the hospital, and ultimately you're responsible for that bill. You care. You care what they do and how much it costs. I unfortunately was in the ER 3 weeks ago, and I got the bill last week, and for a bag of salt water, saline solution, for 24 hours, they billed me $5,400 for a bag of salt water. It cost the hospital $3. Given that I'm ultimately responsible for that, I care. If I wasn't responsible for that, I wouldn't care. And so now I'm through CrowdHealth. We do this all for you. Through CrowdHealth, I'm battling with that hospital to say, hey, you got to give me a fair price for this. CrowdHealth is battling the hospital. I'm not really doing it. And I think that's a healthy thing for our health insurance system, or our healthcare system, is to have battles over prices that are egregious. And health insurance companies just pay it. That's just what they do. So I think this is a health market. Forces are healthy for the healthcare system, and right now they're non-existent outside of CrowdHealth.
You said that if I pay cash, most doctors are going to say, yeah, it's less hassle, I'll get it. But if I can charge $5,000 for a $3 bag of saline, why don't I just keep doing that? What's my incentive to work with you guys if you're going to try to undercut me that? I mean, how the hospital, if you're only paying $50 instead of $5,000?
Yeah, and the hospitals don't play along. The description I was telling you is more like your everyday doc. The hospitals want to charge as much as possible, and they will fight you tooth and nail for it. And so that's why we on CrowdHealth side is when I get that bill, I submit it to CrowdHealth, walks through it with me and says, hey, this is what this is. This is what this is. This is what this is. And as we're walking through it, they're like, this is a bag of saline that's used to hydrate you. And then you go over and you say, and that was $5,400. And you're like, hold on a second. That doesn't make any sense. And they're like, agreed. And so this is one of the ones that the attorneys are going to focus on when they reach back out to the hospital, that you paid $5,400 for a $3 bag of saline. And so we will fight you. We will fight the hospital on your behalf for that, so that we can get that bill. My original bill, I think, was like $26,000. After discounts and negotiation, I think it will probably be around $4,000. And again, CrowdHealth is doing all that. If I had gray hair, it wouldn't be turning gray because I'm not worried about it. Crowd Health is the one that's doing all that work. But the hospital systems are the ones that are trying to extract as much value out of the system too. When I was referring to the other docs, these are your run-of-the-mill docs. These are your primary care docs. These are your even specialists, cardiologists, and things like that who are meeting with you. Once you get inside of a hospital, the game changes because they have you captive, almost literally. They won't let you out until they approve you. And so they will price gouge the heck out of you. And that's where Crowd Health can come in and help you negotiate that bill down. So our average negotiation now, I think, is like 60 or 70% off of that original bill. We'll negotiate with the hospital. And that's one of the big learnings. When I got that that $8,000 bill for my daughter, I didn't know that I could negotiate that. But in fact, you can negotiate those bills down significantly. I probably could have negotiated that one down to about $2,000 as opposed to $8,000. I just didn't know. That. We do all that negotiation for you.
Yeah, it's a shame. Seems predatory. Let me ask you.
It is. And there's going to be a lawsuit around it. There is going to be a lawsuit around this issue guaranteed in the next 12 to 24 months.
You're talking about a class action lawsuit through hospital systems in general or something? Yeah.
I can almost guarantee it.
Obviously, people are saying this sounds like a lot of upside, a lot of good. Insurance companies you guys are 6,000 people. There's 300 million people in the U.S. It's a small percentage of it. Probably is no big deal. But let's say you guys scale and now you're up to 200,000 members, 500,000 members. What's going to prevent the insurance company from saying, hey, this is bullshit. You're cutting into our game. We're the big guys. We got all the lawyers. We got all the money. We have politicians in our back pocket. How do you survive?
Yeah, it's not an if. Again, they're going to do that. That's no doubt that they will do that. They have a lot of money. They pay a lot of legislators or lobbyists. Those lobbyists have pretty significant sway over legislators. But so I think that we are rooted in some of the just fundamental laws of our country. And I've spent hundreds of thousands of dollars with regulatory attorneys to ensure that the laws that they would have to overturn to outlaw what we do are going to be very painful. Because in essence, what I'm doing is I'm fighting for the little guy. I'm fighting for the person who is uninsured, who wants to be uninsured. And everybody dislikes insurance companies. If you think about this politically, the left hates insurance companies and the right hates insurance companies. Like, they don't really like insurance companies, nor especially the voters. And so I think we're going to find a place here where we're going to be able to survive, because similar ways that Uber and Tesla and all these other people who survive, or Airbnb survived, if we can grow quickly enough, if we can get enough people in our membership, then we have a big enough population where if you shut us down, you're going to hurt a lot of people. And we're banking on that. And if we can really truly show that our method is a better way of doing this, then I'm hoping legislators will come on board. And in fact, we've had a number of conversations with legislators who are looking at this and they're like, holy crap, can this scale? Like, how do we make this scale? And so they're very interested in what we're doing. So I hope the opposite thing happens, where people look at this and this could be the solution to solve healthcare in the United States. Because I truly think it could be. So that's our hope. But it's hard to not start a company because you're afraid of the big guys squashing you. It's one of my motivators. I want to go after the big guys because what they're doing is immoral from my perspective. So let's fight the battle.
Yeah, I guess the one thing is, if you've got these people that are very sick and they may be excluded from being able to participate in what you do, unfortunately. The other thing is,
we're going to allow them. It's a matter of time, right? Right now, I'm pouring the foundation for something in which we can use our processes and systems for people who have somebody on MS is something like $60,000 a year to take care of them, right? Under our system, it would be $30,000. That's still a lot, but if we can show that we have a system to treat people who have chronic conditions or conditions that they've had since birth, congenital conditions, then I think we've got something super special. And I do believe that we can show, even with the chronic, that we can significantly decrease this. This is something you talk about a lot too. We got folks with diabetes, primarily type 2 diabetes, right, that are almost 10% of the population right now. The vast majority of them can be reversed. And people with diabetes in our country are sucking up about $1 trillion worth of healthcare expenses. About a quarter of healthcare expenses are going to diabetics. about a third of that trillion is actually going for diabetes, but it's all the comorbidities of diabetes that's costing, a ton of money. And so that's a place where we'd love to work with somebody like you all to say, hey, let's go in and focus on folks with diabetes. And we're going to be able to show that we're going to get their A1Cs from 9 down to 6 and significantly impact healthcare costs there. And that's the next stage for us, is like, how do we move into some of these more complex conditions and help those people? And if we can show that we can do that at a significantly lower cost, that's where I think you get people really interested.
Yeah, I think you're going to have to, if you're going to solve the health issue, you've got to quit creating so many sick people. You've got to figure out how to reverse the chronic disease burden, because I think it has to be part of the equation. One last thing, and you mentioned like some of the regulatory stuff. Correct me if I'm wrong, but I think for me to drive a car, I have to have a car insurance, right? That's mandated by law, state law, federal law, I don't know. How do you prevent them saying, hey, you got to have health insurance? I know at one point they were like, Obamacare, you have to have, or you pay a fine on your taxes. Mm-hmm. How do we know they're not going to say, hey, look, we're going to just legislate everybody needs to have health insurance? It's part of either we go to a national system, NHS, like they do in the UK, or what are your thoughts on that?
Yeah, they had a law a few years ago that was, and I think it was Obamacare started, where everybody had to have health insurance or you paid a fine. The Trump administration removed that fine. And what I've heard legislatively from people in DC is that was the most unpopular part of Obamacare, is that of requiring health insurance for people. And so there are 5 states, I believe, that do require health insurance: California, Massachusetts, Rhode Island, DC, a couple others, Vermont, something like that. And so we have a lot of people in those states who just pay the fine. And they're like, look, I'm saving so much money that I can still pay the fine and get crowd health. And so, yeah, it's not good for us if more states go in and do this. But I do not see, and I've gotten reassured in the legislative branch in DC, that this is not something that anybody is interested in. There would be a huge battle around this. Yeah, it is a risk to the business, but it's not a high probability.
Andy, unfortunately, I got to go. Thank you for sharing this stuff. Andy, I look forward to talking more to you about perhaps there'll be a way to symbiotic between what we're doing at Revero and what you guys are doing there. And thanks for doing what you're doing. It's interesting stuff. So awesome.
You as well. Thanks so much.
Take care, guys. Bye-bye.